And before going to my presentation, I would like to just say a few words regarding my passions. You may already see my profile that I'm very much passionate about promoting robotics activity for children and girls programming activity. You will see 3 pictures there. 2 pictures are from the International Robot Olympiad 2018 and 19. I was the team leader of both of the year, and also I am an international central committee member of International Robot Olympiad, and by the grace of Almighty, Bangladesh participated for the first time in 2018, and they got the gold medal both in 2018 and 2019. And the leftmost picture, this is from the girls programming contest. We arrange every year the National Girls Programming Contest, and I'm the convener of National Girls Programming Contest. And in the front side, you will see a man sitting there. He is our ICT minister, and from last 3 years, ICT ministry is actually promoting our high school programming contest. And this 2 topic is my passion. And now I would like to go to my the topic of today's presentation. Okay. And the main topic is the fighting against COVID-19 using robotics and AI. And we know that we are all passing a very bad time during this pandemic. And actually, for this pandemic time, we all are locked down in different places. And in our country also, people are getting through very tough time. And if we this is today's statistics that till now the total death is 413,000 and total cases is 7 million, where the total population of the world is 7.5 billion. So actually very much tough time for us. And we are trying to flattening the curve throughout the world, and we all know about this curve that by taking some protective measures, we are trying to flatten the curve, and the robots are being used for various purposes to fight against this pandemic. If we see some applications and robotics and artificial intelligence, it can be used for early detection of the diseases, early detection of the vulnerable areas, and also for identify risk using contact tracing information, diagnosing the symptoms, monitoring social distances, identify the people who are not wearing masks, sterilizing medical equipment, disinfect the hospital areas, deliver the goods to the hospital staffs and the patients, identify the people who are at risk, predicting the next pandemic. It's a lot of areas where we are using robotics and artificial intelligences. So we have to, I would like to focus some specific robots and some specific applications. From this picture, you will find that how actually artificial intelligences are using. We have a lot of data, the people who are suffering, from which area they are suffering, what are their symptoms, and what are their age, what are their socioeconomic conditions. A lot of data we have. So we can collect the data from epidemiological data area, from clinical data, from genetic data, and we can analyze this data using artificial intelligence, machine learning, deep learning, and then we can give some prediction. We can diagnose, we can operate hospitals, and we can give some prescribe some medicines. So artificial intelligence is using all the way. And you will find some robots, these are the petrol robots. These petrol robots are used for the autonomous navigation purpose. And they have the high resolution cameras, live images, and even they can report suspicious activities who are not wearing masks, who are not keeping the social distances. And some other countries where we are not using the robots, we have people from police and from the law enforcement, they are giving the petrol, but it's our limitation that we cannot do this for 24/7. But if we deploy the petrol robots, we can get the service 24/7. And by the integration of artificial intelligence, cloud computing, big data processing, actually these robots can perform amazingly. Okay, so it will be a good combination. Yeah, here are some examples of petrol robots. Like the first picture is from the Guang Airport, China. So these robots actually monitor who are not wearing the mask, who are not uh, maintaining the social distances, and if they find that some more people is not wearing the mask or not maintaining the social distance, they give the message to them, and even also they send a message to the authority that these people are violating the rules. And the next picture is the petrol robot, which is used in Tunisia, and it is also used for large areas to find the people who are not maintaining the rules of the COVID-19. And if you find the statistics that how many medical staffs are suffering from COVID-19, the total 90,000 people throughout the world. This is the data of the last month of the Reuters news. Like total 90,000 people are suffering. Like for USA, 19% people, health workers are suffering from COVID-19. And even in my country, Bangladesh, 11% health workers are infected with COVID-19. And actually, we have to, if we give them the support to the medical workers, medical staffs, it will be very much helpful. And for this reason, actually, we can use the doctor robots. Some robots we can use to give support to medical staffs, like the robot which is in Italy. The name of the robot is Tommy. Actually, it can monitor the different vital signs of patients, and they can report to the doctor. The second robot, it can give the physiotherapy so that the health workers can maintain the social distances. The third robot can draw blood from the patient's hand vein, and we don't need any kind of human intervention to this type of things. And also another important aspect is the disinfection robot. And autonomous disinfection robot, it can reduce the risk of spreading the virus, and they are using ultraviolet C and hydrogen peroxide vapor. So the picture you see that is from the UVD autonomous disinfection radars, and they have the lidar, they have the sensors, and they can navigate automatically. And if they found that when they are disinfecting, if any people are there, they just stop the disinfecting process, so that the people don't get the get the direct exposures of the disinfection process. Like there are some other disinfection robots like Nimbus, Xenex. XAG is a drone. Like mainly the XAG drones were used to spray the insecticide in the agricultural field. But during this pandemic area, they're converted their drones, and they're using it to spray disinfection for this disinfection purpose. And recently in China, they deployed 2,600 disinfection robots just for the disinfection purpose. And also some delivery robots are used to deliver food, medicine, and patients' samples to the lab, and also reports to the doctor. Actually, they're trying to eliminate the human intervention, human touch, so that the virus doesn't spread much. And the deployment of autonomous daily robot actually also lowered the workload of the health staff. We know that all the health staffs are really very much passing tight time to for the patient to serve the patients. And these type of delivery robots can move autonomously. Even they can move from one floor to another floor using the elevators. And we don't need to give any human intervention for this. The first robot, the Kinon delivery robot, actually it is used in the lab to deliver the pathological samples. And in the right side, you will find the Zipline delivery drone. Actually, Zipline is a California-based company, but they're also delivering medical equipment in African countries. And the Zipline delivery robot, actually, they can fly in very big speed, night speed, like 100 kilometers per hour. And though the payload is a bit lower, it can take the load around 2 kg together, but it is not. But it is okay for delivering the medical equipments. And also, not only the hardware things, we also have the software robotics processes, like robotic process automation. We say software robotics. And for during COVID-19, RPAs are all can be used to combat the COVID-19. And RPA ensures improved operational efficiency, scalability, and also it decreases the operational cost. And also actually it can do a lot of works, not only giving the support but also the predicting. At first I mentioned about the big data processing and artificial intelligence. So RPA can be used for these intelligent things. Like it can be used for the testing and diagnosis purpose. It can accelerate COVID-19 testing and reduce waiting time. It can test up to 90% task using just RPA bots, and they don't need any human intervention. And also it can accelerate patient diagnosis. The robotics process automation can accelerate patient diagnosis. Also it can detect the COVID-19 patients, and also it can give the consultation by telepresence robots. So, and it also can be used for treatment and curing purpose. RPA manage the collaboration and communication of clinical data among the multiple teams of process to reduce the vaccine development period. So it can be used for many purposes, and also for recovery and monitoring purpose. Screening bots monitor the health condition of the employees, and it can diagnose if they have any problems or not. It can track the COVID-19 updates, monitor the risk. It can manage safe return of people to COVID-19 free areas. And also for back office operation, also it can contact the center support to manage query. It can also use like intelligent chatbot to give the services. It can do the rapid registration of the patients, manage testing requests, streamline healthcare claims. Actually, there are a lot of applications where we can use the robotics and artificial intelligence. I will just go for 3 more software-based robots, like for the predicting the risk of infection. If we have the data of the infected people, like what were their health conditions, what were their social habits, what general hygiene habits they usually have, what are the frequency of the interactions of people with them, their location, their climate. So like if we have large pool of data, they can use the data and analyze the data, and they can predict, like for me, what is the possibility of getting infected by the coronavirus, and what is the possibility of getting infected for a certain areas, for certain type of people, for certain type of climates. So actually we need a large pool of data for this type of the big data analysis. And also we have some virtual chat bots. They can chat with the people and also can give some recommendation, also give some prediction, food recommendation. They also recommend whether these people need any isolation or not. Also they can give some food suggestions, and also the protected recommendations. And I would like to go through the comments through now, because actually I don't cannot see the 2 windows together. So I was in my chat window. So I am here now to take the questions if there is anything. Okay. So like when do we draw the line between the use of these robots and human intervention? Actually, I was mentioning that there were some like delivery robots. They can be used completely autonomously. There are some petrol levers. They can actually work completely autonomously. In that cases, we don't need the human intervention. But for some cases, we also need some human intervention, but it is very much reduced. And also, it can reduce the workload of the people, workload of the health workers, and mainly for the predicting, we can use the artificial intelligence and big data analysis. And you are also saying about like ethical considerations. That is a very good questions. Like the technology that we are using actually. Like when we are using like contact tracing applications, it's a huge question for the ethic, like the my confidentiality of my data. So even in these cases, like right now in our country, we're developing at one contact tracing applications, but there was some concern about the whether we will use this data for this purpose, or we will use this data for another purpose also. Like in that cases, we have a contract that this data will be used only for this research purpose, and it will be not used for any other purposes, and this data will not be given to any other people. So actually, when we're taking this data for analysis, we also need to maintain the secrecy of the data, the privacy of the data also. And how are the people responding to all these technology changes, especially during this COVID time? Actually, it's we are very much used to with the technology. Like in a developing country like Bangladesh, people were not that much friendly with the technology, but from the last 3 months, we are using technology for all purposes from our daily life. So now it's getting some changes in the mindset of the people. Now they are accepting the technological uses before our before time. Okay. So like we have 2 minutes more. So if I go to the my last slide, it was like the deployment of autonomous robots not only protect the patients and medical staffs, but also help reduce health workers' load. There is another debate like is the robot is causing the unemployment. So actually we say that it's not causing the unemployment, actually it's transforming the employment. So like for some low-end work, it is replaced by robots, but for high-end creative works, it is not replaced by robots. So there is always some trade-offs. Some jobs are diminishing, and also new trend is opening. So actually, I don't want to say that robot will create the unemployment, and it is actually robotic and artificial is a very important tool to fight against this pandemic. And we must explore this opportunity to collect an authentic data, and we apply intelligence to automate the whole process and fight against COVID-19, and now and also in the future. And please stay safe, and we are passing a very bad time. So we please stay safe and stay healthy. Thank you very much.